the global coronavirus index, which is the highest ranked of effective and handle the virus and recovery. So this is my objective of this study. There have three. The first one is analyze the Thailand leadership and strategic skills or ability. Then I will evaluate them. Also provide some recommendation for the Hong Kong leaders. To evaluate of the Thailand leaders' leadership strategy skills, I will use two models. One is a SWOT analysis, then is the health leadership components model. For the SWOT model analysis, as we can see, the Thailand healthcare system under the COVID-19 actually have some strengths. For example, they have advanced health promotion programs, variable primary healthcare, like a group community healthcare system or facility, and innovative development of the health system. However, they have some weakness. For example, the shortage of medical professionals and the political instability. And under the COVID-19, there have some threat for the Thailand. For example, the economy is decreasing, and the coronavirus actually affects the tourism industry of Thailand and raise the unemployment. For the opportunity, the virus may advance the health science and engineering and communication technology, or improve the next pandemic response. Then let's move into the health leadership components models analysis. In these cases, the leaders I defined the Thailand government and the MOPH Ministry of Public Health is the leaders, because they are the mainly respond to the or handle the COVID-19 situations. For the first one is about the community cooperation ability, which means aware different needs in the community and to cooperate with them. Actually, the MOPH Ministry of Public Health is decided a website only related to the COVID-19, and in this website it provides tailored information for the particular groups, for example, elderly, children, or healthcare staff. Also, they launched a new helpline which is staffed by a mental health professional teams, and to provide the mental health support is because we know that under the COVID-19 actually many people the stress or pressures is increasing. Finally, they initiate a volunteer program with offer training to support the clinic medical and health awarenesses across the country. Second is about the communication skills or ability. For the internal, the Thailand government actually have a daily public communication national TV broadcast, which include the update information and about some confirmed cases, death or tests, etc. with multi-language. Then for the external, because Thailand as a Asian members, the leaders have updated and shared the latest COVID-19 situation for them and through the email or the video. Also, they will communicate with the international partners closely by managing the website and conduct a press conference as well. Next is the initiative. The government is developed an online platform which called Thai China, which is a mobile phone app, can check in the customer by the QR code check-in out in the restaurant or the shop. Also is let the customer may report their irregularities to government. On the other hand, they also innovated a new normal medical service model, which is classify the patient with different disease in 3 traffic lights level to decide the relative plan, like use the telemedical or to arrange the patient to the health care facility with a upgrade ventilation system. The third one is about the cooperation ability. The Thailand government actually cooperate with some medical leaders, experts from MOPH or the medical schools and academic agency from other departments to develop an effective strategy. Also, they invite some infection control nurses to formulate a personal protective equipment standard to the country. On the other hand, the MOPH also partner with the private sectors and the non-MOPH public hospital to keep the respondent capacity. Finally, it's about the professional and society responsibility. The government is launched a simulation programs to hire and employ graduates to work in the community development project in the countryside for 12 months. Also, they extend a half-year grace period for those who covered by the social health insurance members. To evaluate, it is found that the Thailand leaders possess great leadership ability and fully understand the SWOT. The first reason is the leaders is adopt a multi-layer leadership ability or skills to overcome the system weakness. For example, as I mentioned, the MOPH will work with the MOPH public hospital and the private sectors. Also, the government launched the volunteer programs to invite the volunteers, which may increase the workforce to overcome the medical professional shortage, also enhance the effectiveness of healthcare services and the healthcare literacy. Second is the leader is understand the grabs opportunity. It's because they are initiative to advance the healthcare technology such as the online platform Thai China let the government know and can monitor the social community situations. Also, they improve the next epidemic responses and have a long-term and sustainability plan in healthcare like the new normal medical service model. Then it's about the threat. Although the government is not really overcome the threat, but they still provide some like the simulation programs to try to reduce the unemployment, also to extend the grace period of the social health insurance members. Then I will talk about what Hong Kong leaders can learn from the Thailand. The first one is Hong Kong leaders can enhance the community cooperation and cooperation ability. It's because Hong Kong is also facing the shortage of medical professionals like Thailanders, and also the COVID-19 effect there is increase the pressure of the public medical and demands of the emergency department. Therefore, it is suggested that Hong Kong leaders can cooperate with the private sectors or clinic and the family doctors to provide the basic primary care service, virus detentions, or a referral system to decrease the pressure of the public sectors and increase the healthcare literacy. Another lesson for Hong Kong leaders is they may try to raise the initiative. It's because Hong Kong has another community outbreak, and also the virus hidden transmission cases are increasing as well. therefore develop a tracking fire system and a free monetary nation testing is necessary. However, the political crisis may reduce the response to those anti-epidemic plans. Therefore, Hong Kong leaders should improve the transparencies and the equity, or they may invite different sectors from the society to consult and decide the anti-epidemic plan. To conclude, the Thailand leaders possess great leadership skills to overcome the SWOT, and also they provide a effective and sustainability strategy to handle the COVID-19. For Hong Kong leaders, there are some good leadership ability. It's worth for the leaders to study, like the community cooperation and initiative. And this is my reference. And this is the end of my presentation. Thank you.
OK， 咁同學有冇問題啊？
我想問我咁樣寫有冇話唔啱方向？
啱方向啊！
啱方向。好。咁
而家 problem 有咩 solution 啊？個 solution 寫得比較詳細啲喎，係咪？
好。
即係因為你個 solution 你唔係一句説話就搞掂㗎嘛，你要解釋下點解呢個 solution 會係即係咁樣安排，佢入邊啲詳細嘅例係會點樣，需要一啲咩嘅資源係嘛 ？problem 就可以寫短啲，solution 寫長啲。咁又要限住啲字數喎，咁所以要分配下啦，係嘛？就揀即係最好嗰3個啦，係咪？而家唔係叫你寫本書啊嘛，寫張 paper 要人哋睇得落嘅。仲有冇好下一位同學？好，有冇下一位同學 ？OK， 咁可以開嗰個 upload PowerPoint，如果有嘅話。